Good day, everyone. Thank you for joining me today. My name is Paheli Bhatt, and I am a dietitian at HCG Astha Cancer Center, Ahmedabad. My presentation is titled Nutrition in Oncology Supporting Patients Through Dietary Choices. In this session, we'll explore the critical role of nutrition in cancer care and how dietary choices can help improve treatment outcomes, manage side effects, and support overall patient well being will be discussed. Before I start, I would like to thank Ms. Poonam, the dietitian of UN Mehta Hospital, for fostering such a valuable knowledge sharing session. So, let us begin by understanding what is cancer. Cancer is a group of diseases marked by uncontrolled cell growth. These cells divide without regulation, often forming tumors. They can travel via blood or lymphatic system to distant organs. It may affect any part of the body and it is a major cause of illness and death worldwide. So, cancer is a multifaceted disease that requires a comprehensive understanding and approach to tackle its impact. Now, let's look at some key statistics and trends around cancer in our country. In the year 2020, there were approximately 1.5 million new cancer cases reported, which is increasing constantly. Sadly, cancer causes around 7 to 8 lakhs of deaths annually. Among women, the most common cancers are breast, cervical, and ovarian cancers, whereas for men, lung, oral, and esophageal cancers are more prevalent. The major risk factors include tobacco use, alcohol consumption, and urban lifestyle changes. Few genetic mutations and immune conditions also play a role in cancer risk. The late stage diagnosed cancers lead to low survival rates, especially in the rural areas with limited treatment access. There is also a gap in awareness about prevention and early detection. While survival rates are improving in urban centers with better care, they still remain low in the underdeveloped countries. Unfortunately, we are expecting a 3 to 4% annual increase in new cases of cancers, driven by an aging population and lifestyle changes. So, overall, we need to see that how important is for us to timely detect and prevent the cancers. The cancers are named based on where they originate. The carcinomas start in the epithelial cells like breast, lung, or colon cancers. These sarcomas develop in the connective tissues such as bones or muscles. Leukemias are the cancers of blood and bone marrow, whereas lymphomas are the cancers which affect the lymphatic system. The central nervous system cancers originate in the brain spinal cord. Few cancers are due to genetic factors, but majority of the cancers are modifiable which occur due to our lifestyle, which are the tobacco use, diet and obesity, alcohol consumption, certain infections and radiation exposure. The symptoms of cancer vary depending upon the type and location of cancer, but there are few common signs which should not be ignored, and they are unexplained weight loss, constant fatigue, pain in any part of the body. There are skin changes, changes in voice, unable to swallow food, so lumps and masses in certain parts of the body, etc. Now, coming to the most important part, let's begin by understanding why nutrition is so important in cancer care and how does it impact cancer treatment. Nutrition boosts immune function. It maintains the muscle mass and strength. It manages the side effects of cancer as well as of its treatments. It improves the response to treatment. The increased risk of cancer patients due to malnutrition is always due to muscle protein breakdown and treatment related symptoms. There are over 30% of patients which are nutritionally compromised right when the cancer is detected, and gradually more than 60% experience malnutrition during the course of their illness and treatment. Now, why is it so important to address malnutrition on the correct time? Because if not addressed correctly, it leads to an irreversible condition called cachexia. This cachexia means severe weight loss, muscle wasting, and weakness. So it is important to timely identify and intervene in the effective management of cancer-related malnutrition. And if not corrected timely, it reduces a person's quality of life and increase the chances of morbidity and mortality. So as we can see, the following images depict the impact of malnutrition and how critical it is to address it for improving overall outcomes and not just weight. Few triggering impacts include the post-surgical complications, as a result of which there is an increase in hospital length of stay. The physical function is decreased, and as a result, there is a reduction in overall quality of life of a patient. To save the patients from getting into malnutrition, there are certain goals defined by nutritionists, and they are nutritional screening and assessment, identifying the nutritional gaps, intervention, and regular monitoring throughout the course of their treatment as well as later on. This not only supports the health and well-being of patients, it supports proper growth and development, it manages with existing or pre-existing medical condition and gives a good quality of life to the patients overall. So it is really important to screen and assess the patient as early as possible, for which there are various tools available which carry out the height and weight of the patient, the BMI, the clinical observations, biochemical parameters, the diet history, etc. All these factors jointly help us identify the individuals who are at risk and intervene for the nutrition intervention. For cancer patient, there is one reliable tool known as subjective global assessment. So here's an idea how SGA looks like. It is really important for assessing cancer cachexia and identifying early malnutrition. So coming to few essential nutrition guidelines for cancer patients, which are laid by the Indian Association of Surgical Oncology as well as the European Society of Parenteral and Enteral Nutrition. What do the guidelines say? They suggest a calorie intake of at least 25 to 30 calories per kg per day for the cancer patients, as well as the protein intake needs to be from 1.2 to 2 gram depending upon the nutritional status of the patients. Apart from these, the help of oral nutrition supplements, as and when required, there can be a change in the mode of feeding of the patient as well as the symptom management for certain symptoms like nausea, anorexia, etc. need to be maintained along with the help of few experts involved in MDT care. But as we know, it is always easier said than done. It is really challenging for the cancer patients to cope up with the impacts of the cancer treatments. Here are some nutrition management strategies for various treatment modalities of cancer. Starting with the surgery, we can see that the effect on nutrition which surgery causes is loss of appetite, disruption of digestion, and changes in the bowel functions, due to which there is difficulty in eating and swallowing. It may be that the mode of feeding is changed, due to which the patient does not feel like eating. So what do we do in such cases? We need to feed the patient with small frequent meals. We can monitor the electrolytes and micronutrients, especially in the GI surgeries, as well as we may consider enzyme replacement in certain surgeries if required. Certain side effects of chemotherapy include nausea, vomiting, mucositis, etc. So what does it do? It reduces the food intake. There is difficulty in swallowing. There is altered taste due to which there can be weight loss because the patient may not be able to eat well. So how does our nutrition management strategies help? We can advise small frequent meals. We may advise smaller portions with good calorie and protein intake. Like we can take help of nutrition supplements as and when required. We may modify the texture of the food due to which we can encourage more food intake to the patients, and we may then ultimately change the mode of feeding when required in few chemo and radiation therapies. Similarly, the eating difficulty occurs in the patients with bone marrow transplant or targeted therapies. The patient might experience mucositis or maybe loss of appetite due to the treatment. So, in such cases, if there is persistence, diarrhea or vomiting, we may check upon the hydration first of all, apart from focusing on overall nutrition. If there is constant fatigue in the patients, it is really important to provide them with enough calories and protein. Certain side effects of hormone therapy include weight gain, hot flashes, and mood swings. These hormonal changes may affect appetite, metabolism, and fat distribution. It may either lead to weight gain or weight loss. So, in both cases, patient goes under malnutrition. So, what do? We suggest a balanced diet in order to manage and maintain weight along with regular physical activity to support overall health. In the immunotherapy patients, there is constant fatigue. There may be certain gastrointestinal side effects in which there may be visible weight loss, the muscle protein depletion may occur, and electrolyte deficiencies may occur. So, in these patients, we give nutrient dense, easy to digest food. We watch constantly their hydration and the electrolyte balance, apart from encouraging them high calorie, high protein foods. So, during discussion, we saw that there are certain nutritional challenges which are common in all modalities of the cancer treatments, such as loss of appetite or anorexia. It is really common in all the patients. The taste changes might be experienced for patients undergoing chemotherapy, radiation, or the cancer itself may cause the taste perception alteration. So what we can do here, we can enhance the food flavors, food textures. We may use certain spices. We may change the heatness or coldness of the foods. I mean the temperature of the food. We may balance the meals alongside the nutrition supplements. If the patient is having dysphagia, we may alter the consistency of the food. If we see malnutrition, etc., we may take off further some good functional foods or supplements in such patients. So these is how we help patients maintain their energy levels as well as hydration alongside nutrition. But the psychological impact, which is majorly unseen in the patient, is real, because as we know the food is directly related to our emotions. So these ultimately settle down if the patient is nutritionally optimized. We may observe that there is direct impact on his mental status, whereas directly opposite situation, if we see, if the patient is under stress, anxiety or depression, he may overeat or undereat. So in both cases, it is really important to manage the food along with the emotions. So as we say, it is not advisable to be so strict on the cancer patients. We always have to be on a lenient side alongside ensuring that proper nutrition intake is managed by the patient. So, certain dietary strategies have been laid for supporting nutritional challenges, like incorporating nutrient dense foods, managing dietary restrictions. It is not advisable to put a lot of restrictions on the cancer patients. We need to balance the macro as well as the micronutrients like fiber and water, means overall hydration. Constant nutritional monitoring is important, and regular follow ups with the patient is really important, because if you lose contact connect with the patient at any point, and when you come, the patient will be surprising you. It might happen that he or she comes with a giant weight loss or nutritional losses. So when in such cases it becomes difficult for us to manage at last. So how we can do all these things? We can try small frequent meals, we try high calorie nutrient dense food, we modify the texture or taste of the patient, we try to change the mode of feeding, we try to comfort the patient by his own familiar foods. Of course we have to ensure the prescription of correct foods to the patient. ऐसा ना हो कि we misguide the patient, like if there is radiation going on, so we should not advise the patient, yes you drink some sweetened beverage in order to soothe your throat. No, it is totally wrong that we advise a lot of sugars and sugary drinks to the patient, just labeling them as comforting foods. So there's when our profession comes into consideration. So even after so much planning and counseling, you can never judge the level of compliance, as all days are not same days for the cancer patients. Something which can assure food intake or overcoming nutritional challenges are the nutrition supplements. These supplements are scientifically proven to provide patients with specific calories, proteins, or micronutrients. So, it is always advisable to take help of a qualified professional and have nutritional supplements for all the cancer patients. So, our job does not end just by counseling the patient alone. Involving his or her family is really important, because we have to plan the meals. We need constant support for the patient to prepare and plan the meals. There has to be somebody who emotionally and psychologically supports the patient during his entire treatment, who enjoys family meals alongside patients, the for the collaborative decision making. In each step we have to involve the patient's family in order to get good results of our counseling. Now let us have a look at people who combine as a MDT in cancer care, as no single person is solely capable of helping a patient get through his or her cancer treatment. So, what does a multidisciplinary team do? These are doctors, nurses, dietitians, therapists, social workers, pharmacists, etc., who come along and help the patient. There is a holistic care given to the patient, which provides a well rounded approach addressing medical, emotional, nutritional, and social aspects of care. These people combine together and lead to improved patient outcomes, efficient resource utilization, they help in enhanced communication. So, overall, there is a patient centered approach. The patient feels important and feels like there is a ray of hope to live life, and overall, there is an improvement in quality of his or her life. So the few key takeaways from today's session was that nutrition is a critical part of cancer care, and it can influence treatment success and quality of life. We addressed few common nutritional challenges and how we can support patients alongside their families for tailored dietary choices. We discussed upon the holistic approach to cancer care. There should be continuous monitoring, additions, deletion in nutrition and diet plans of the patient, and how we constantly commit to improve in providing cancer care to the patients. Thank you.